first, you would ask a question about their history. So mine would be previous history of injury. And first, do I have permission to touch you?
Yes, you do.
Okay. First, we're going to do bony palpation. So the first one we're going to do is the styloid process of the radius, which is right here. And next would be Lister's tubercle, which is in line with the third metacarpal. It's right here. And the next would be the lunate, and to see that more, what's the word?
Prominent?
Yes, prominently, you bend the wrist, and you can see the little bump right here. That's the lunate. And can you flex your or extend your thumb? Okay, so right here is the anatomical snuff box, and on the radial, the radial border is the extensor pollicis brevis and the abductor pollicis longus. On the ulnar border is the extensor pollicis longus, and it turns at Lister's tubercle. And the inside of the anatomical snuff box is the scaphoid. So the next would be fracture testing. So the one I'm going to do is passive wrist extension to check for scaphoid fracture. So I'm going to extend the wrist, and if that recreates any pain, then that would be a positive, as well as tuning fork. Oh no, where are the tuning forks? Wait, I'm gonna get a tuning fork. I forgot to grab one.
I bumped it. We bumped it.
Okay. So, I'll do it with the prominent bones. So, the styloid. Oh, does that feel weird? Lister's tubercle. The lunate. And we can do the scaphoid. And that's it.
Start out, we'll ask her some questions like, where does it hurt? First, before I begin, do I have permission to touch you?
Yes.
Okay. First, we're going to start out with some bony palpations. First, we're going to find the trapezoid. So you come from the scaphoid over, and you find the trapezoid right here. Okay. Then you come over to the hamate. On the palmar side, the hook of the hamate is right. Yes. It's right here, actually, right there. And so the hamate should be right here, and you can move it too. Next, we have the metacarpals. So we have the first metacarpal here, second metacarpal, third metacarpal, fourth metacarpal, and fifth metacarpal. Then we have the PIP joints. So we have the PIP joint on the second finger, third finger, fourth finger, and fifth finger. And then we have the phalanxes. We have proximal on the first and distal. There is no middle on that. On the second finger, we have proximal, middle, and distal. And then proximal, middle, distal on the third, proximal, middle, distal on the fourth, proximal, middle, distal on the fifth. For fracture testing, we are going to do tapping of the distal ends of all the finger joints. So,
however you want to do that.
We are going to do
this.
Yeah. Gotcha. That's what I thought. So just do it like this. Throughout. You're good. And then there's not a couple of non-traditional ways. So we'll have the patient take their arms out and just kind of like look at their knuckles for any decompression. As you can see, there's no decompression with any of her knuckles. There's also if you close the fingers as well. So if you turn them this way towards you, so then you can see the fingers closing. And if there's any overlapping with the fingers, it could also mean that there's a fracture as well.
Well, first I'm gonna note that in the last video I forgot to mention the radial artery is on the radial border of the anatomical snuff box. So, yeah. I forgot to mention it. Okay, so next is range of motion. So first, I'm going to do wrist flexion. And wrist flexion should be from 80 to 90 degrees. So, you could, you're gonna have to go on the table just to make sure. If you could lay your arm straight on the table, I want you to put your hand up, starting up, and then I want you to flex it down. Okay. So I'm gonna put the stable. Oh shoot! It has to be on the lateral side. No, it has to be on the lateral side.
Oh.
Yeah, so do this arm. Okay. Alright. So I'm gonna put it at the joint line. You could start up. This one. And now flex your wrist up and way down as far as you can go. And then I can passively put it back more into flexion. Next would be honor deviation. So, yes, I just need you to hold your arm out for me. And then I'm gonna put it in line with either middle finger and wait. Yeah. If you could put your wrist towards the smartboard, please.
Yes.
And then passive.
Oh god, I thought you
And for honor deviation, you want about 35 degrees. Okay, so next would be soft tissue palpation of the radial collateral of the thumb, which would be right here. And the radial collateral ligament of the thumb extends from the head of the first metacarpal to the proximal phalanx of the thumb. So here to the proximal phalanx of the thumb. And that's it for that one.
Okay, so we're going to start with the range of motion. We're going to do supination. So can I have your arm like this?
Maybe I should stand up. Yeah, or half stand so you can see.
And then put it at the middle finger, because that is the finger that sticks out the most, and it is our axle of rotation. And then can you please take your hand and move your palm to the sky? Okay. Now try to do it more.
That's all I got.
It's okay, that's fine. And then we're good. That should be about 90 degrees. And then we're going to move on to soft tissue palpations, the volar plates of the hand, thumb, and fingers. Okay. So the volar plates start right here at the top of the metacarpals and go all the way to the distals of the phalanx. So we're going to stress it by pulling it back. Should feel some resistance while doing it, especially with the thumb here. There we go. And then we have the TFCC, which is the triangular fibrocartilage complex. It is on the ulna side. It is connected. Yeah, we'll do this. It is connected at the metacarpal, the distal metacarpal here, or proximal, my bad. Goes down, connects the ulna. Then it also connects slightly into the medial side of the radius, also over here. It creates a triangle form. So
next, we're going to do muscle palpation. So the first muscle that I'm going to do is the extensor pollicis longus. Can I see your arm, please? Okay, so the origin is the posterior surface of the distal radius. I have to look at myself. So, like right here. And it inserts on the base of the distal phalanx of the thumb. So it goes to the distal phalanx of the thumb. And that performs extension of the first MCP and CMC, abduction of the CMC, and it assists in radial deviation, and its nerve innervation is deep radial nerve. Next would be the flexor digitorum superficialis. So can I use this one? So the origin is the medial epiconda, if you could bend your arm so I can find it. The medial epiconda of the humerus and the cornoid process of the ulna. And it inserts on the base of the middle phalanges. So it goes across here, and then it goes to the base of middle phalanges 2 through 4. So right here. Wait, the middle phalanges, and its action is flexion of flexion of 2 through 5. Wait, I have to make sure. Yeah, 2 through 5. Yeah. Its insertion is 2 through 5, not 2 through 4. I don't know why I wrote 2 through 4. Scratch that. The insertion of the flexor digitorum superficialis is 2 through 5 on the middle phalanges. And its action is flexion of 2 through 5 of the MCP and the PIP joints. And its nerve innervation is the median nerve. Next is the flexor pollicis longus. Okay, I can use this one. The origin is middle half of the anterior surface of the radius, so here. And its insertion is the base of the distal phalanx of the thumb, so to here. And it goes on up to here. And its action is flexion of the MCP and the IP joint and assists in wrist flexion. The nerve innervation is the anterior interosseous nerve. The last muscle is the abductor pollicis. This is what's it called? Intrinsic. That's the word. Is an intrinsic muscle. The origin is the anterior shaft of the third. Maybe I use this one. The anterior shaft of the third metacarpal and bases of the second and third metacarpals and the capitate, which is below the third metacarpal. Insertion is the medial side of the base of the proximal phalanx of the thumb and the extensor hood. So here, the proximal phalanx of the thumb and the extensor hood. So, on anatomy zone, it's like a little triangle, like right here. Maybe. Oh, sorry, I was twisting your arm. And its action is adduction of the thumb at the carpal metacarpal joint, and nerve innervation is deep branch of the ulnar nerve.
Okay, so we're going to do some more muscle testing. First, we have the wrist flexors. The wrist flexors are made up of three muscles. We have the extensor carpi radialis, the extensor carpi radialis brevis and longus, and we have the extensor carpi ulnaris. There we go. First up, I'm going to do the extensor carpi radialis longus. It is at the dorsal part of the lateral supracondylar ridge. I cannot speak right now. So, right up towards this area right here. That is the origin, and the insertion is the dorsal base of the second metacarpal. So, bring it way down to right here. The nerve innervation is the radial nerve, and the action is extension and abduction at the wrist. Next, we have the extensor carpi radialis brevis. Its origin is at the lateral epicondyle of the humerus. So, I feel right there. And then its insertion is at the dorsal base of the third metacarpal. So good. Right here. The nerve is the deep branch of the radial nerve, and that action is extension and abduction of the wrist as well. Next, we have the extension carpi ulnaris. That one inserts also at the lateral epicondyle of the humerus. The insertion is the tubercle on the medial base of the fifth metacarpal. So, bring it all the way to here. And the nerve innervation is the posterior interosseous nerve. And the action is extension and adduction at the wrist. Next, we have the thenar eminence. This one is also composed of three muscles as well. We have the abductor pollicis brevis, the opponens pollis, and flexor pollis brevis as well. First, we're going to start out with abductor pollis brevis, and this one is on the radial side of the base of the proximal phalanx of the thumb and the extensor hood. So, right here, that is the insertion. The origin is the scaphoid and the trapezium and the adjacent flexor of the reticulum. So right here.
There we go.
Right there. The nerve innervation is the recurrent branch of the median nerve, and the action is abduction of the thumb. We are going to move on to the opponents.
Opponents.
Pollis. I'm doing great. Got this. Lateral. Its origin is on the tubercles of the trapezium and the adjacent flexor of the reticulum. So, right here. And then its insertion is the lateral margin and adjacent lateral palmar surface of the thumb to the thumb metacarpal. So, all the way over to here. Right.
Yeah.
Yeah. Yeah.
You're good.
Okay. The nerve innervation for this is also the recurrent branch of the median nerve. The action for this is the flexion of the thumb. Next we have the flexor pollis brevis. You have a superficial head and a deep head. The superficial head is on the dorsal border of the flexor's reticulum. So back over here. And then the deep head is also on the trapezoid and the captate bones, so more towards here for the deep head. Insertion is the radial aspect base of the proximal phalanx of the thumb, so right along here. The nerve innervation for the deep head is the deep branch of the ulnar nerve, and the superficial head is the median nerve. Action for both of these are flexion at the metacarpophalangeal joint of the thumb. And then our last one is extensor indicus. This one's origin is the posterior surface of the ulna in the adjacent interosseous membrane. So, yeah. Yes. Technically, it's right here. Yeah. And then the insertion is the extensor's expansion hood of the index finger. Okay.
Rotate.
Yeah, it rotates around. Here. And the nerve innervation for this is the posterior interosseous nerve, and the action is extension of the index finger.
Extension of the index. I'm going to be doing ligament testing. So first I'm going to do the carpal metacarpal joints of the hand. So you want to stabilize each one. Oh, sorry. That sounded atrocious. Felt atrocious, actually. And now we're going to be doing volar plate. Let me do this hand so I don't have to twist your arm. Of 2 through 5, and then we'll do the thumb after. So they're volar plates on MCP, PIP, and DIP. So to stress them, you'd pull back on each one. These are the metacarpal, or the MCP. And then this is the PIP. And now the DIP. Next, I lost my. Oh, thanks. Last is the thumb. It has an MCP and the IP. So here's the MCP, and here's the IP of the thumb. Okay, So now we're going to do muscle testing of the interosseous palmaris, which is the abduction and adduction of the digits. So first this one. First I'm going to do abduction. So I want you to spread your fingers outward. We'll do a little bit at a time. And I'm going to... Okay, you did active. Okay, now I'm gonna give you some resistance. Okay. And now we're gonna go like halfway, and I'm gonna hold it. 1, 2, 3, 4, 5. Okay. And then we're gonna flip over, do active again. Thank you. Now we're gonna do resistance. Yeah. There. That wasn't hard to resist. And now we're gonna do break. So we're gonna go halfway. 1, 2, 3, 4, 5. And then for these ones, do active. Now I'm gonna do resistance. Doesn't look like I'm doing much, but I am. Okay, middle and break. 1, 2, 3, 4, 5. Okay, now we're gonna do adduction. So I want her to bring her fingers inward. Thank you. Now I'm gonna give resistance. Oh God, how do I do this? Okay, Now go. Oh wow. Okay, now I'm gonna do middle, and we're gonna do break. 1, 2, 3, 4, 5. And now we're gonna do. You go in, not out.
Yeah, no, I started out.
Oh, sorry.
Sorry, my bad.
No, you're good. All right, now I'm gonna resist. Yes. Now do it. Yes. That was hard. I don't know how to hold it. Yeah. Okay. Now I'm gonna do break, so halfway. Now go. 1, 2, 3, 4, 5. Now to the middle. Thank you. Okay. Active resistance. Yes. Okay. Now go. My finger's in the way. Wait. All right. Come on. Now go.
Okay.
Yes. Okay. And now you put it in break. 1, 2, 3, 4, 5. Oh, I hate that one. That one's rough.
Yeah.
Okay. Next is extensor pollicis longus and brevis. So I forgot what I was supposed to do. For this one. Oh, it's extending the first. Okay. I need to move this over. Put your hand off the table, please. Okay. So we'll wait. I want you to bend your fingers like this. Yes. And I'm gonna hold your hand like this, and I want you to extend your fingers to the ceiling. Thank you. And now I'm gonna give resistance. And now we're gonna go halfway. 1, 2, 3, 4, 5. Longus and brevis do exactly the same thing, but I guess I can do it again. Do it again. Thank you. Alright, now resistance. And now halfway. 1, 2, 3, 4, 5. Okay. Next is adductor pollicis, which causes adduction of the thumb at the carpal metacarpal joint. So How do I want to explain this? It's your thumb going to the middle of your palm. Yes. Okay. So I'm gonna stabilize here. Wow, this is hard to stabilize. Okay, now bring your thumb in. Okay, and now I'm gonna give resistance. Now break. 1, 2, 3, 4, 5. Okay. Now is the opponent's digiti minimi, which flexes and rotates the fifth and contributes to opposition of the fifth. So I want you to flex your pinky in. Yes. Now I'm going to stabilize here. Okay, you can see it. And I want you to flex. Okay. And now I'm going to provide some resistance. Now move halfway. 1, 2, 3, 4, 5. Okay. That is it.
Ligament testing. If you can you place your arm straight with your wrist hanging up?
This way.
This way. First, we're going to do ulnar and radial collateral ligament of the wrist. So I'm going to stabilize a little bit right here. Can you just rotate your wrist side to side like this? There you go. Okay. Now I'm going to put some resistance on this way. Good.
Wait, this is ligament testing.
Oh.
Not muscle testing.
Okay. So, good. Right?
Yeah, you still stabilize.
But
that.
yeah.
But you have to do like this shit.
Yeah, so. Good.
I'm sorry.
No,
need
you're
to
good.
relax.
Okay. Now we're going to move on to muscle testing. First are the wrist flexors. I'm going to have you with your arm extended. The elbow is going to be extended. Her hand's going to be over the edge, and I'm going. Right. Yeah. Okay. And then she'll bring her hand into.
Is it my full wrist flexion?
Yeah.
So
yeah. So I'll stabilize right here, and then just go down. There you go. Then I'll provide some resistance. Go ahead. And halfway. 1, 2, 3, 4, 5. Okay. Next up, we have the flexor digiti superficialis. There we go. Again, we're going to have her in the same position with the elbow extended. I am going to just scoot back a little though. Because I have to stabilize at the PIP joint, so right up here. So.
Oh, sorry.
No, you're good. So then their finger is going to go into flexion. So if you could bring it down, there you go. Okay, ready? Good. Halfway. Ready? 1, 2, 3, 4, 5. Do it again with the next one. There you go. 2, 3, 4, 5. Again. There you go. There you go. 1, 2, 3, 4, 5. And this. Go ahead. Go. Good.
My pinky's weak.
1, 2, 3, 4, 5. And then we have the extensor digiti minimi. So I'm going to stabilize at the MCP. Extend. Okay. And then they're going to bring their fingers upwards. So if you can do that. Good. Now, put some resistance on it. Good. There you go. Then halfway. 1, 2, 3, 4, 5. You would do those individually as well.
We're saving time.
Yeah. Lastly, we have the lumbricals. These are you're going to Also be in the same position with your hand out as well. I'm going to stabilize at the MCP. We're going to flip this though. You're going to bring your fingers inwards. There you go. Now, I'm going to do singular on this one. There you go. Now resistance. 1, 2.
Sorry.
It's break. Sorry, my bad. Now do it again. Active. Resistance. Now break. 1, 2, 3, 4, 5. Again. Active with that one. Go resistance. There you go. Break. 1, 2, 3, 4, 5. Now active. Resistance. Now break. 1, 2, 3, 4, 5. Also, with the extensor digiti minimi, it cannot be isolated either.
So next, we're going to do special test, and the one I'm going to do is the Allen's test. So I'm going to push on the radial and medial arteries and have Cora flex her hand 10 times. You'll see the magic happen. Wait. Okay, flex. Very cool. Okay, now I gotta do it again. Do the other side. Alright, go. Oh my god. Oh my god, it was turning blue for a second. I was concerned. Oh my god. I never want to do that again to you. I never want to do that again. Okay. Next is Tinel sign, which is percussion to the lateral side of the palmaris longus. Lateral. So, can you go like this? And a positive for that would be recreation of the feeling. Yeah. And then also for the Allen's test, a positive is the returning of the blood flow is not like immediate. Like it's just like poor or not there at all. Okay. Yep.
Okay, so the last one for special test is a scaphoid fracture. So if you can have your elbow on the table like this.
What elbow?
No, that should be okay. So I'm going to stabilize right here, have my hand here, and we're just gonna go back and forth with it. There will be some popping and everything, but positive tests would probably be recreation of the symptoms as well. So
Wait, he told us to do another one.
there's also a shearing one within the hands. So you would find the scaphoid, and you would also find the lunate, and you would shear those together as well.
Yeah, I feel that.
And a positive test with that would be you would feel the subluxation in there, meaning that there has been torn ligaments between the scaphoid and the lunate. So.
Perfect.